Okay, let's talk about that stabbing heel pain that just will not go away. We're talking about chronic plantar fasciitis. But what if there was a modern, really minimally invasive way to fix it that, get this, doesn't even involve surgery on your foot? Well, today, that's exactly what we're breaking down.
I want to start with a question, because if you know this pain, you really know it. Does that first step out of bed in the morning feel like you're walking on broken glass? That sharp, searing pain shooting through your heel? Yeah, if you're nodding along right now, you get it. You know exactly how much this can just ruin your entire day.
And it just sucks you into this frustrating cycle, doesn't it? You've done all the stretches for months on end. You've gone to physical therapy. You probably spent a ton of money on special orthotics that didn't do a thing. Maybe you got cortisone injections, and sure, they helped for a little bit, but that pain always came roaring back. You find yourself avoiding walks, not playing with your kids as much. It's just this constant, distracting, exhausting pain.
So what is really going on inside your foot that keeps this pain cycle going? To understand the solution, we first have to dig a little deeper into the root of the problem, especially when it becomes chronic. It's a bit more complicated than just simple inflammation.
Okay, so here's the key. In cases of chronic plantar fasciitis, the damaged area starts to grow these tiny, abnormal blood vessels. There's a fancy name for it, neoangiogenesis. But just think of them as these little troublemakers that are constantly feeding the fire of inflammation, keeping that pain signal permanently switched to on. And this, right here, is why all the stretching and temporary fixes often fail. They aren't addressing this underlying plumbing problem.
And that leads us to what I call the old dilemma. For so long, you were basically stuck between a rock and a hard place. On one side, you've got the temporary fixes, pills, more injections, which have their own risks and almost never solve the problem for good. And on the other side, major surgery, actually cutting the plantar fascia. It can work, but you're looking at general anesthesia, a super long recovery, a cast, or a boot. It's a big deal. You can see why people have been desperate for a door number 3.
And that brings us to the really exciting part, door number 3. This is a modern, minimally invasive answer called plantar fasciitis embolization, or PFE for short. And believe me, it is a total game changer, because it tackles the problem in a completely different way. So, what is PFE? The core idea is actually kind of brilliant in its simplicity. Instead of cutting tissue, PFE goes after those tiny abnormal blood vessels we were just talking about, the ones feeding the inflammation. It's a super precise, image-guided procedure that essentially just calms the inflammation down right at its source. That's it. It lets your body finally do its thing and heal.
This quote really says it all. Instead of cutting tissue, we simply calm the inflammation. It's an elegant, targeted approach. You see the difference? It's about working with your body, not declaring war on it. It's a fundamental shift in how we think about treating this kind of chronic pain.
Okay, so you're probably wondering, how does this actually work? It sounds almost too good to be true. Let me walk you through what's often called the pinhole procedure, and you'll see just how incredibly straightforward it is.
Right, so it all starts with a tiny entry point, and I mean tiny, like a pinhole. And it's made in your wrist or at the top of your thigh, nowhere near your painful foot. From there, using a live X-ray that acts like a GPS, the doctor guides a super thin, flexible tube, think of a spaghetti noodle, all the way to those little problem arteries in your heel. Then, they release these microscopic particles that gently block up those abnormal vessels. They're basically just turning off the tap that's feeding the inflammation.
So let's just stop and recap the huge differences here. There is no cut on your foot. 0. No tissue is removed. There are no stitches in your foot. When it's all done, all you have is a tiny little bandage on your wrist or thigh. That's it. It's pretty amazing when you think about it.
The procedure itself is one thing, but let's talk about what really truly matters. What's life like afterward? How's the recovery? And how fast can you actually get back on your feet and back to your life?
And just look at this comparison. I mean, this is where the difference is just night and day. With surgery, you're looking at general anesthesia, a cut in your foot, and weeks of recovery, probably in a boot. With PFE, it's light sedation. You go home the very same day, and most people are back to light walking in a day or two. The difference in the recovery experience is just massive.
Now, here's something important to remember. Because this whole thing works with your body, the relief isn't like flipping a light switch. It's gradual. You go home the same day, you're walking around the next. And then over the next few weeks, as that inflammation finally calms down, you'll start to feel a real difference. And that improvement just keeps going over the next couple of months as your foot gets the chance to heal properly, maybe for the first time in years.
So, who's the perfect person for this? Well, see if this sounds like you. It's a fantastic option if you've been battling heel pain for 6 months or more. It's for all the people who've tried everything, physical therapy, orthotics, injections, and nothing has stuck.
And, of course, it's a huge deal for anyone who just wants to avoid the risks and that long, painful recovery that comes with traditional surgery.
So I'll just leave you with this question. Just close your eyes and imagine for a second, what would it feel like to step out of bed tomorrow morning without that jolt of pain? To go for a walk, or play a round of golf, or just get through your workday without constantly being reminded of your heel? What would that feel like? It's a powerful thing to think about.